Okay, so I see some new faces here, people who I haven't met, so welcome. I'm Tipo, the Executive Director of Foundation Beyond Belief, and I joined in September of last year. So the reason why we wanted to do this fireside chat is just to give transparency into what FBB is doing, the impact that we are making, and how your support can really help us. Tonight, we have two of our beneficiaries, including Wholesome Wave and also Austin Atheists Helping the Homeless. And we also have a presentation from DC Central Kitchen. Before we get started, I just wanted to give a brief introduction of food insecurity. So I'm just going to pull up a presentation that I have. Okay, so welcome again to our first official fireside chat. So with food insecurity, what is food insecurity? The USDA defines food insecurity as a lack of consistent access to enough food for an active, healthy life. And there are different levels of food insecurity. So there's high food insecurity, marginal food insecurity, low food insecurity, and very low food insecurity. Depending upon how often households face food insecurity, they would be categorized according to one of these levels. All right, so how much food insecurity is there in the US? In 2019, 1 in 10 households faced food insecurity. That's 35 million people and 5 million children. These numbers seem pretty high, but it is a decrease from previous years. Since 2011, there has been a trend downwards. 2011 had 14% food insecurity in the US, and in 2018, there was 11.1%. However, since the pandemic, food insecurity has risen, so we've kind of reversed trends. Northwestern Rapid Research Report show that 1 in 4 households facing food insecurity. That is 50 million people and 17 million children. A lot of this is because of the increase in unemployment due to COVID-19. For households with children, this number increases to 29.5%. The most vulnerable populations: children, Hispanic households, Black households, rural households, and senior citizens. So Black households are twice as likely as white households to face food insecurity. Hispanic households also face a greater amount of food insecurity, as do children, senior citizens, and 2.2 million rural households. Much of the US actually lives in what is called a food desert, where they have little access to food. How can you help? Financial support. $1, according to Feeding America, buys 10 meals. $20 can buy a bag of groceries. $100 can buy food for an entire family for a month. Other ways to help are also through volunteering. You can donate or start a food drive, volunteer at food pantries, or deliver meals. Restaurants, stores, and farms also often have food rescue programs in order to avoid food waste. All right, so what has FBB done to help? Our mission is to end poverty and hunger, promote good health and well-being, and foster employment opportunities and economic empowerment in ways that exemplify humanist values. Hunger is a deeper symptom of poverty. In order to help solve this issue, what have we done? Before COVID-19, we donated $205,000 to Humanist Grants, Beyond Belief Network, and other campaigns. Since the pandemic, we've raised over $17,000 in order to address poverty. And this is especially in communities that are the most marginalized. We've raised money for peer justice, which funds help for local communities, including sanitation, food, and other necessities. And for our Ghana program, we've been delivering monthly care packages, which include hand sanitizer, soap, and food for families. These are just a few of our humanist grants beneficiaries and our Beyond Belief network. We have an extensive Beyond Belief network, and 21 of those teams address food insecurity. One of these teams is with us tonight. That's Austin Atheists Helping the Homeless. And we've also donated to the Ali Forney Center, Baker Ripley, Pure Justice, Refugees International, and Soil, all of which address food insecurity. So I'm going to turn it over and introduce our first presentation tonight, Phil Sessions. Phil heads the Austin Atheists Helping the Homeless. Phil grew up in Dallas, Texas, and he is very active in the community. He is one of our FBB board members, and he also has been a large part of Austin Atheists Helping the Homeless through monthly food drives. So I'm just going to turn it over to Phil, and he can talk a little bit about what he's doing.
Awesome. Thank you so much for that, Tiff. I appreciate it. Okay. Awesome. Well, thank everyone for coming out tonight for this Fireside Chat. I know I was, excited. It's a hard issue to look at, but it's one that doesn't get enough attention in my mind. I mean, especially, in the secular community, in, the humanist community of those that want to go out there and make an impact on so many people's lives that are being affected on that. So, back, years ago, we would go out, every month. It's every first Sunday of every month, every first Sunday of every month, 9:30 a.m., boom, we're there in downtown Austin under the I-35 bridge at 7th Street. And that's our main area. And back then we used to serve so many people. We would have maybe 20 to 30 volunteers out there. I'll show you a little bit of how that goes. And this is, kind of what it looked like out there. We would have maybe 16 to 17 tables worth of items out. And so this is just one half of it there in Arthur here with his two kids in the front. But we would have two lanes. We would go right in front of the police station, as you can see in the background there. And we would have this huge crowd out. We're serving 200 to 300 people every single month coming through these lines. And, the need just kept on growing. I remember years ago when we used to prep to serve maybe 50 people, and it just kept growing and growing. We had to keep on adjusting how much we were preparing for, because when you run out, it's one of the worst feelings that you see. Myself as an organizer, for the volunteers that have to, tell recipients that we have nothing available. But, since the pandemic started, so last March, in the middle of March, we started getting reports from several people that we have connections with there in downtown Austin. So the constable's office out there, a few of them out there, a few other community groups that are out there will give us kind of little reports. So kind of we know what to expect or where people are located in case people are shifting around, stuff like that. We started getting reports in mid-March of 2020 that a lot of providers, due to the pandemic, were stopping their services temporarily, and these are people that provide food. There's groups that would go in there, they would have things like eggs and bacon and, little wraps, all these kind of things. It's on the weekends. That's usually when a lot of the individual providers, the community organizations would come out. And we kept getting reports in late March that so much of it was drying up all of a sudden with no immediate plan to replace the need. And so when I was talking with my team towards the end of March of 2020, it was a conversation about, well, what are we going to do? Like, we're getting these reports, folks are needing help more than ever, but a lot of people are not going out for safety. So it was just discussion after discussion, just Facebook with just messages flying all over the place with people weighing in. But ultimately we decided that this community that we serve, we have gotten to know these people. We've been there for years. Every first Sunday at 9:30. You know their names. You start to know some of their stories. You know, they know you, and they come up and say, here, they usually look for my hair. Is usually how they identify me very quickly out there. Big black guy with glasses in the fro. That'll, you know, get it every time. But we decided that we have to change the way we do things, but we're going to go out there. And so we started adapting to this new reality of COVID. We started limiting how many people could come out. We changed, rather than doing the big tables, we started pre-packing in this way. And so we actually gathered together like this, no more than 10 people at this particular event, where we will pre-pack bags and store them in order to give them out the next day. And so we go out, we split up into groups when we go out so that people are not clumping together in order to get those supplies. And it's worked out a lot better than we thought it would. You know, we've had to make a lot of adjustments, but what I will say is when things first got started with the pandemic in April, we got reports that a lot of our population that we served were no longer there. They had, you know, kind of moved on a little bit. And when we went out there to our main location, it was less than 1/5 of the people that we see, less than 40 people or so were out there. And we started asking around as to where everybody was, and asking folks that live out there, you know, where did everybody go? And they pointed us to a new encampment that had formed organically because the city of Austin decided to finally, after we'd been asking for years, to put a porta potty and a hand washing station out and accessible. So a couple blocks over away from the downtown area, I don't think that was an accident. They put this, and all of a sudden it was a huge tent city that had sprung around it on the sidewalks. Just people were everywhere. And we realized very quickly that the amount of bags that we had prepped of the food items, because we were focusing on food because we got all those reports about the lack of resources. And when we got out our vehicles and started to kind of go around, people started running up to us, quite literally running up to us, trying to get a bag. And it is hard to describe the faces of folks that are in line. They're trying to be respectful. They're trying not to crowd around. We were trying to make people spread out due to COVID. This is just at the beginning. So we're like, everybody spread out. You have to back up just a little bit. And it was just a harrowing experience when you look in people's eyes and they are afraid that you're going to run out of a bag of food, you know, that you're at any moment, you're going to give out the last one, and they would have missed it. It was a hard thing to watch. And we did indeed run out, because we only prepared for 150 or so because of the reports that we had received about people starting to disperse. And so we didn't think there would be as many, but they were, you know, at least 150 plus at this encampment alone that had formed over the course of just a few weeks. And that need, the pandemic has not lessened the need for, you know, helping with food insecurity. It has only deepened and worsened that, especially for the population that we're serving down there. And so we started switching our gears very hard to focusing on additional food items. We shifted some of our toiletry funds, because we only have a certain amount of budget to work with, depending on what donations we get, how much money we have available coming in, to decide what can we get and provide to the community this time around. And it's been an incredible experience. It's been a lot of learning that we have done over this pandemic to serve, you know, these folks out here and to do better. We still did our winter campaign to keep them warm and give out thermal underwear and thermal socks and hats and gloves and stuff like that. But, you know, they had no expectation that the bottom would drop out on their resources for food out here on the streets. And, you know, to be dependent on community organizations to provide the bulk of your food that you experience, you know, through the month I cannot imagine what that is. But you saw a little of that in the faces of those people when we went out for the first time in the 1st of April to see those faces. And when we did run out, we ran back to our cars to figure out what we can do. We had more granola bars. And so we started going around just handing out fistfuls all over the place of just anything that we could, because nobody was out there. There was no providers out there helping with food insecurity out there. And so it was a harrowing experience, but we were glad that we were able to play a part, that we continue to do so. And, being a part of BBN, they've helped in the past, like with grants, for example, for going out there. I know we used the grants for socks a long time ago during the winter time because we didn't have enough money to buy that. And so it was just one of those things that, okay, like this is what we want to do. And, can we have to do it? So actually applying for the grants and getting that. But it is a problem that is not going away. It is a problem that needs much more attention, not only from community organizations and humanist organizations, but also from the government outreach standpoint, because there's no way that this population should have been dependent on community organizations as small as we are for providing the bulk of their food. But we were able to do so, and now people are kind of coming back a little bit. But it's something else, something that you would never expect to see in the middle of this bustling, huge city with all these skyscrapers and all this money. And yet there's a population of 200 to 300 that are living homeless right there in the downtown area or just one block away from it. And so that's kind of what my group that we focus on. We know we play a small part in this huge cogwheel of the continuum of care is what it's called in the Travis County area. But that part is integral. It is needed. It is necessary. And we hear it from the people that we serve when they come up to us and say, thank you for coming out. We heard that in April, May, and June, so much more than normal, to say, thank you for coming out, because most people have not. It was a huge thing. And we stood by that decision. We were safe, of course, and made those adjustments, but there's no way we could have left this population with, even less than what they had after everybody dropped off like that. So that's a little bit about what we do.
Thank you so much for telling us all about what you do, Phil. And thanks for all the work that you're doing. It really is important because a lot of these local communities are not being served. We did have a question for you. Joyce wants to know, you've spoken a lot about how there's shortages, you don't have enough food sometimes. How can grocery stores and other institutions prevent food waste and distribute their food to help organizations like Austin Atheists Helping the Homeless and other organizations that serve food insecurity?
I mean, for other organizations, especially things like, your Walmart, your HEB, stuff like that, a lot of them have partnerships with Feeding America. So they, funnel to the local food bank and try to recycle what they can. But one of the issues is they don't necessarily come out to these locations to distribute that food. And so in some parts of the US, depending on your food bank and their services, you may have what's called a mobile pantry. And that mobile pantry service that you can sign up to volunteer for will actually, they'll give you bags of food that you will actually travel around to drop off at certain locations. And so I would definitely suggest, since a lot of the big players, Sam's and Walmart and HEB here in Texas, they already do a lot of contribution there because, it looks good for them on paper just in general. And so they put some effort there. But having volunteers at the food bank to help distribute that out. Meals on Wheels is also another one. If no one has ever gone through that process to actually sign up to get that food to certain people. But here in, even in San Antonio, when the pandemic first started, we have a lot of folks in our community down here that are, older, that may have more risk of going out and getting groceries. And so, I reached out to several people to ask, hey, can I go pick up some groceries on your behalf or something like that? And I'll drop them off on your doorstep. so they don't have to endanger themselves in that way. I can put on a mask, I'll go out there and I have all the hand sanitizer and everything else. But, for groups like ours, if there's a group in your area that is actively going out and supporting, I would definitely reach out to that group or looking to see if they have a website or something where they can be supported in that effort, because for a lot of those groups, they're dependent on what they receive is directly what goes out to the public. And the more they receive, the more they can actually do, which is exactly what we do. Depending on what we have, we will do additional things. We'll get, more food in there, or other toiletries, or things that are not as common, like reading glasses, for example. We've been able to do that several times because people out there requested them because they can't read their documents when they actually go to see their social worker to try to, proceed in their process of getting into a housed environment, for example. And so we did a big drive a year or so ago about reading glasses, and we were able to get about 200 pairs out there to the community. And, we had an eye chart and everything. It was all, it was all well done. But, reaching out to those local groups that are in your area, finding them, doing a search on Google and find out who's in your area, who's out there helping, and reaching out to them to say, how can I best support your efforts to get out there, because you're doing it and I want to help.
Thank you for that. And Joyce also really wants to know, are there any community refrigerators? Because sometimes food is not necessarily non-perishable. So.
Right. There are, I thought I've heard of some little projects like that starting in around Austin, which is the area that I serve in. But what we try to deal with is in everything that's non-perishable. And so, we're looking at, applesauce that doesn't, go bad for a while, your Jellos, your cup of noodles, because in Austin, as we found out from our population that we serve, they can actually get access to hot water. Kind of like if you work in a commercial environment, you have the coffee making, you have the little spigot where you can get that hot water. There are municipal buildings and some gas stations that are nearby in the downtown area that will actually allow folks to actually use that. And so they can actually have noodles or something that needs to be heated up in that method. And so giving cups of noodles is a thing we started adding in as just a way to keep warm, especially during the winter months, just as a way to keep that warm. So since we weren't doing the coffee and hot chocolate like we used to back in the old days for safety reasons, that's kind of what those kind of switches off to. But I've heard of those community refrigerators. I haven't seen anything that was nearby the area that we are. I haven't heard of any services that are doing that in particular. It's typically just providers going out. There are a few people. We would love to do things like bacon and eggs and like taquitos and all that kind of stuff. But in the city of Austin, you have to have an event permit, which is $1,000 each time you use it. And that made that very prohibitive. So that idea was shelved. And so Nutri-Grain bars, granola bars, things that are soft for people that may not have the best dental access to dental care. So no apples, for example. That's one thing that I do put out there. Bananas and oranges if you're going to do fruit, but no apples, please.
And I guess along the lines of that, so there's one issue of food insecurity and there's another issue of nutrition insecurity, and people who face food insecurity are most likely to face nutrition, or more likely to face nutrition insecurity, simply because, like you said, you have to deal in non-perishables.
Right.
Is there a way to balance between that, given that you're so limited both by what you can purchase in terms of how much money you have, and also again with the non-perishables?
Right. We've tried to do some more focus on, doing Nutri-Grain bars. We still have granola bars and stuff like that. But like noodles, for example, it's very sodium rich. That's that's one way to put it. But, we've tried to just change our items to be less sugar filled, to try to be more nutritional values, things with more vitamins in them, stuff like that, within the scope of our budget, because some things that we could really go for would just eat away at the amount of food that we could actually do. And so it's a balancing act. And I hate that it is that way, but that's exactly what it is. When you have those limited resources, it's like, can we give multiple Nutri-Grain bars that have, some measure of nutrients in them, some different varieties? We do a protein of some type And so we will have, something like a canned meat. There's like these little tuna packs that are pre-packed that don't need refrigeration. And they have crackers and everything. It's in a self-contained kit. So they're called tuna kits and chicken salad kits, stuff like that. To have a protein, we have peanuts or something like that in there for another, piece of protein in there. But trying to work within it's hard. And so we just try to make those best decisions that we can along those lines. But yeah, there's no choice but to focus on getting as many meals out there that we can, because we didn't know when their next meal would come along, where they would get it from, how substantial it would be. And so if we could do more items that have some nutritional value and give them more of it, that may be worth it more than doing, just one thing, just taking care of one meal that is more well balanced, but then leave them possibly bottoming out for the next couple of days until they get their food from another source.
Yeah, I mean, that definitely makes sense. And I think that whatever you're doing is still really important just because you're meeting immediate needs there.
Right.
I know folks probably want to know how they can get involved both with your group or if they want to start a similar project in their own communities. What's your advice to them?
Yeah, I mean, for our group, of course, it's just looking us up online. If you're anywhere near or around the Travis County area, or just want to donate, Austin Atheists Helping the Homeless, we do have a website. If you search atheists.help, you will actually find us. So that's the website, atheists.help. Will lead you. It doesn't matter if the atheist is plural or singular; both will get you there if you want to find us. But I just had a conversation just yesterday, as a matter of fact, with someone that was talking about starting a group themselves. We kind of went over, but it's looking at first identifying who you want to serve, where are they located, how many are in that particular area. What are your local laws around what can be distributed at your location? For example, in San Antonio years ago, it was illegal to distribute bottled water, and you could get a ticket for doing that. So that was a thing. It is no longer a thing, but it was back then. So we had to be very cautious about handing out bottled water. And it's such a simple thing, but checking those local laws to make sure that you're not in violation, because the last thing that you want is a ticket or something that is horribly dissuasive for you, for going out there again. Finding a public place that doesn't impede a right of way. And it's starting small, being smart about your purchases. And so what I always try to suggest is, you start with maybe 40 or 50 people and you start researching in your area to see like, okay, Dollar Tree is the best place to get razors. They're 10 for $1. You can't beat that. For toilet paper, probably Dollar Tree or your Walmart is going to be your best bet, where you can get four for $1. In Walmart, it's a little less. It's about 88 cents for 4 rolls, for example. Doing research along those lines to make your dollars spent. You can get toothbrushes on Amazon, 144 for about $12. You can get 144 tubes of toothpaste, fresh scent toothpaste, for about 23, for example. Those are the types of things that you have to think about. Granola bars, Sam's Club, they have the 60 pack for about $8 on that side. Water, Sam's Club, once again, that's a 48 pack. It'll cost you $3.98, if I'm not mistaken, something along those lines. But it doesn't take a whole lot to get started. It's not this soul crushing amount of money to do, because we used to prepare for just 40 or 50 people. And it doesn't take a lot to do so. Find you a friend or two, have a collective, so it's not just all on one person. That's also very important. And start putting your message out there. Go on Facebook, start a Facebook page and start, showing pictures of, these are the people that you're serving. This is what we want to do, and try to garner a little bit of support that way. But, don't get discouraged right off the bat if things aren't as big as you intended, or you couldn't buy as much stuff, because that is always a frustration, that you can't buy what you want because you don't have the resources. When you're getting out there, you're starting small, you build that and grow over time. We've been able to do so much more than I ever would have envisioned when I first started doing this. I mean, we're doing, bus passes, 200, 31-day bus passes 4 times a year. Like we're doing one next month, for example. And it's just like, that is beyond anything that I would have been able to come up with, thermal underwear to 250 people like that. That was the furthest thing from my mind. And it's happened organically over time as people have gotten interested and get to know about who you are, what you're doing, that you're making a direct impact, and that you need help to do so. So many people want to help and don't have the avenue to do so. And by you coming out there and providing that avenue, you may get someone who is more dedicated than you may first think. And they may help you a heck of a lot more. Like the founding group, the collective that runs the Austin AHH group, were just amazing. And we've just acquired people over time, and they've, stuck with us. And all of a sudden, here we are, 11 years later now, starting in 2009, doing what we do. And so it's been an amazing journey, but start small, keep at it. Don't be alone. Don't be by yourself when you do so. Have some support there. And you can always reach out to me. If there's any tips on where to buy things, I got you. Like there are years of research that have gone into where to buy things at what price. I got you.
Thank you so much for all that advice. FBB is really proud to support Austin Atheists Helping the Homeless. I know you're one of our most active teams. And I know there's so many more questions, but because we are limited on time, I did want to give Wholesome Wave a chance to speak. So thank you so much, Phil.
Thank you.
Our next group up is Wholesome Wave. And Wholesome Wave is one of our humanist grants grant beneficiaries. So tonight they have David Juros representing them. A brief introduction of David. Thank you, David, for coming on. David joined Wholesome Wave in May of 2017, and he's the Director of Program Partnerships, managing a team responsible for the expansion of affordable health food access for low-income populations and launching the Wholesome Wave Tangelo app. Prior to joining Wholesome Wave, David worked at American Express and brand marketing companies, where he managed relationships with larger retailers, supermarket chains, financial services companies, and institutional food services companies. David also created a nonprofit based on the vision of his son, Devin, which he called Pleasantville Community Garden. And that has grown in 6 years, donating over 90,000 pounds of fresh fruits and vegetables to an area food sharing organizations in Westchester County, New York. Thank you, David, for coming on. Could you tell us a little bit more about Wholesome Wave and what you're currently doing there?
Sure, absolutely. And thank you, Tiff. Really, really glad to be here with everyone tonight. Appreciate the opportunity to speak to the group. Wholesome Wave has been around for about 14 years. And our mission is to enable access and affordability for fresh fruits and vegetables to low-income populations. As you talked about before, Tiff, our focus is really on nutrition insecurity and helping low-income populations to overcome that. The overarching goal of Wholesome Wave is to change federal and state policy around food justice. So we do that through the programs that we bring. We have changed policy in the past. We've been able to get $100 million into the Farm Bill in 2014, which helped to expand the ability for the nutrition incentive programs that we do to a much wider audience. And then in 2018, that was expanded from $100 million to $250 million, making it a permanent line item in the budget, which is really fantastic. But like I said, the work we do is nutrition incentives, money given to people in low income situations that can be used only to purchase fresh fruits and vegetables. We have a number of different vehicles that we use to do that. The primary vehicle we use these days is fruit and vegetable prescription programs. So a lot of people have heard about food as medicine and that whole movement. The fruit and vegetable prescription programs are really to help foster that. So we work with healthcare systems, hospital systems, a lot of FQHCs, low-income clinics, to create these programs that allow people to, allow the healthcare professionals to prescribe fresh fruits and vegetables alongside of the other work that they're doing with the patients. It really ends up being another tool in the toolkit of the doctors and nurses to help their populations. Doctors and nurses tell us all the time that, I can only tell people to eat more fruits and vegetables, get more fruits and vegetables into their diet. If they can't afford it, there's no way they can just do that like other parts of the population can do. So that's really the tool that we're giving to the clinicians, is the ability to give people the affordability for fresh fruits and vegetables. We also tackle the access issues. Some of our programs, we work with a number of different technologies, which is new for us over the past 3 years to deliver these programs. Some of the technologies we work with allow for home delivery, which obviously has been a really important thing during the COVID crisis. And others allow people to go to the retail locations and make their purchases of fresh fruits and vegetables. So the other really important part about these programs is that working with the healthcare professionals, we track biometrics during the time period of the program. We take a baseline measure before the program. We tend to do a midpoint and a post-program measurement. We look at things like A1C for diabetics. We look at blood pressure for people with cardiac issues. We look at BMI to help with obesity and other diet-related issues across different populations. Our populations that we work with obviously are low income, but we work with pediatric groups, we work with seniors, we work with general population. So it's really across all different ages and areas. Our work over the past couple of years has been focused in California, has been a really important market for us to work in. Our home state of Connecticut, we work in New York City, and we also have a program that we are working on in Texas and Corpus Christi. So those have been our focus areas, but during the COVID crisis, much like Phil, the world changed and changed dramatically very quickly. So Wholesome Wave had to do a lot of quick work to make sure that all of our programs could continue as expected. Some of our programs were set up to be in-person collection, or not collection, but distribution of incentives, either on cards or on vouchers. When COVID really kicked in, that wasn't possible. So we had to redo those programs, make sure that they were able to still be delivered. We created some mail programs. We created different ways of doing things. Again, our focus on technology over the past couple of years certainly helped and allowed us to be able to continue programs in that way pretty easily. Another thing that we did, we have launched COVID-specific programs during this time period, the biggest of which was a CARES Act distribution of funds in Los Angeles County, California, a city that we've been working in for, I believe, 6 years. And we were able to really ramp that up, and we worked with the county and other nonprofits in Los Angeles County to help distribute in the neighborhood of, I believe it was $25 million, which went to about 29,000 individuals and families in Los Angeles County. The single hugest program that we've ever worked on, but so much need, as I know you've all seen and read and heard about in Los Angeles County. We worked with 19 different community-based organizations for the distribution, and we created 3 different distribution streams using an app-based system, a grocery card system, and then a phone-based system for people who have literacy, language, both, and technology literacy issues. So the use of 3 different ways to distribute was critical to be able to reach the population that we needed to. We were able to sign up all 29,000 participants in about 6 weeks, which was part of the requirements from the federal government to get those funds out. So really excited that we met the goals on that. It's the end of the distribution is still happening, but it'll wrap up by the end of February. And we'll have a lot of learnings, obviously, from a program like that that we've done. So we're continuing to expand. Like I said, California and Connecticut right now are our two primary states, working with groups in Florida, Ohio, Virginia as well, as we move forward. Again, all of the data that we're getting from these programs is being used again to fuel the work that our founder, Michelle Nishan, and others in the organization are doing from a policy perspective. So the more data we get, the more data we can pass along to help the cause of making some of these changes at the federal level. So again, the last thing I'll say is that evaluation is a really big part of what we do with our programs, making sure that we're capturing all of the information possible and understanding the effect that we've had, looking at the biometrics of the patients that we've worked with to see how we've been able to impact them, not just from a nutrition standpoint, but also from a health standpoint as well. So I will stop there. I can talk about this stuff for a long time, but I'll stop there so I can see if there's any questions to answer.
Thank you, David. Yeah, these are just really interesting topics, food insecurity, that you and Phil have spoken about, and it's such a big issue. I do want to give the audience some time to ask questions of you. If not, we also have a few questions that FBB would also love to know more about. So I guess you speak a lot about just working with groups, and I know that on your website, Wholesome Wave states that you do not believe in setting up shop in the place someone else calls home to bring our solutions to their people. That is directly from your website. Could you just tell us a little bit more about how you work with community-based groups, because Wholesome Wave is working all over the place. So how do you build those relationships and work at once in the local level, but also national?
Sure, that's a great question. Wholesome Wave has always been really focused on creating those local partnerships for a couple of different reasons. Number one, we're a pretty small organization. We're about 18 people total. So to be able to do the breadth of work that we are doing, we need to really focus on really strong partnerships on the ground. We think of our partnerships as the trusted community partners who know the community, who understand the barriers, the issues. Phil is a really great example of that. He knows the people that he's serving and understands their needs and how to help them as much as possible. So we really rely on our community-based partners to help us understand. When we're working with healthcare partners, again, we're asking the questions, what are your biggest problems? How can healthy food help parts of your population, your patient population that need help? We've been able to refine our process and use our best practices to bring these programs really effectively to the populations. So we look at all of our programs as a partnership between ourselves and the work that we've done to really refine these programs and make them as efficient and effective as possible, with the knowledge base of the community to make sure we're meeting the community where they need to be met. So that's been a really important cornerstone of Wholesome Wave and how we've been able to work.
And in working with these communities, as we've discussed before, certain groups are marginalized, they're more vulnerable to food insecurity. Have you noticed an increase in groups such as Indigenous, Black households, Hispanic households, and what do you do for those groups specifically in order to remain sensitive to, there's a lot of issues going in. Insecurity is a sensitive issue by itself, but when you add those factors in, how do you cope with that? Or
yeah, that's a really important question. I think COVID has really shined a spotlight on some of these racial inequities that exist, and the fact that the food system is not there for people that are marginalized. One truth of COVID is that people who are less healthy, people who do not, use good nutrition in their diets, have been much more dramatically affected by COVID. So as we've gone about creating new programs, and even in Los Angeles, we've made sure that we're much more intentional about the populations that we're targeting, not being satisfied just to target, people of color within the groups that we're targeting, but to really focus specifically on those groups during this time period. Working in Los Angeles County, the county government focused on the most marginalized groups in the city. So the 19 community-based organizations I mentioned that we worked with have a focus on exactly what you said: African-American populations, Pacific Islander, indigenous populations, and Latinx populations that really needed the most help during this time period.
Thank you for just going into that. And so I guess one of the the things that we see a lot in terms of organizations, both in food insecurity and addressing other issues of poverty, they come into these communities and they say this is a prescribed solution. Working with these marginalized groups, how have you ever observed other organizations or that have come in with prescribed solutions that just don't work, where they think it's a good solution initially, but it just ends up to being more damaging?
I don't know if I would say more damaging, but I think what we often see is that it's very easy to put up additional barriers to a population without even knowing it, without being cognizant that you're doing that. We do take a lot of care up front to really understand the population that we're going to be working with. And it really comes down to the realm of social determinants of health and how you're interacting. What are the different risk factors that the population has? One really good example is we've been doing work in Hartford, Connecticut, which is a very high poverty small city in Connecticut. One of the truths about Hartford is that it has a horrific transit system. It's just not functional. It doesn't go to the places that it needs to go to really help people. And very few people in the city have cars. So you have to be really careful on how to create programs to make sure you're not offering people something that then they can't take advantage of. And that really can become defeating. Obviously, you're saying we want to help you, but then the nearest store is 5 miles from where you live, and that's just not feasible. So I think that's what happens more often. And it's really taking that care and time to understand the population. Again, working with the partners that we do, they help us to understand that. And then the other thing that we do too, which has been a result of COVID and the learnings we've had through this, is making sure we're including potential participants in the work that we do as we're designing and setting up programs. Again, critically important to make sure that we're on the mark. We're not providing a service that people don't want or need, or that we're missing something that maybe somebody in the population can help us understand. So I think those are some of the ways that we've worked really hard to make sure we're targeting and designing our programs the right way.
Thank you so much for answering questions and telling us more about Wholesome Wave. We are reaching the top of the hour, so I do want to invite Phil back and David, because I know there are a few questions that we have for both of you in terms of how to get involved and what you forecast in terms of food insecurity for the future as well. So I guess one of our first questions is, what do you think is the single most important thing for people to know about food insecurity, and what's the way to address that?
Phil, I'm happy for you to start.
Yeah, I'll go ahead and let you go. Since you focus on nutritional security, I'll go ahead and let you start it and give my perspective, because it's definitely much more focused.
Sure, no problem. I think, the reality is, and Tiff, you talked about some of the food insecurity numbers, and the big change that's happened over the past year. And it's yet to be seen how long lasting that is, but there's definitive agreement among people that food insecurity is going to remain at a much higher level than it was from prior to COVID. And again, nutrition insecurity has become a really important buzzword because of the fact, like I said before, that people with health issues and health risks have been more deeply affected during COVID. So to be able to make sure that people can find and consume the fresh fruits and vegetables and healthy foods that they need in their diet has become more and more important. So.
Yeah, for communities like mine, my organization on the ground, one of the most important things I look at when it comes to this food insecurity is asking the folks that we're serving, what their experience is like, to get data from them as far as, okay, where are you actually getting food from? What are your regular sources? That's how we found out a small building, a small church is actually giving away like little soup about 2 or 3 times a day, every single day in the downtown area. And that's why it formed this artificial tent city around that area. But it's a very limited amount of what they're getting. And so getting information from them on the ground helped us to change up what we're targeting, what we could provide, if we know what their experience is like, and actually taking the time to do polling on that. So even before COVID, 4 times a year or so, we would go out with notepads when we did our giveaways as people went through the line to ask them, hey, how can we help you? What are the things that you're lacking, that we may be able to provide as a small organization, but what are the things that you're looking for that you're not getting from these other groups that are out here, for example, to get some more concrete data to work with, to make the judge. That's how the eyeglasses came to be, hair grease for the African-American population. It's my last count, the last statistics that were out on it, African Americans make up about 8% of the Travis County area, but are 38% or so of the population experiencing homelessness. And that comes with some unique challenges. We started getting hair grease and particular brushes that can deal with this kind of hair, for example, out there on the street, because a lot of those brushes that you may get from other groups may not be made for this kind of hair, for example. And so I've had a lot of African-American folks come up to me to ask me for particular things for our community, because I would be more inclined to know about a Vaseline we brought out. I remember that Miss Wanda was talking about that years ago, saying, hey, we need some moisturizer out because regular lotion ain't working, that type of thing. And so getting information from the population that you're serving is what I suggest to get information, but also being willing to talk with your government organizations in your area. And so we started attending years ago the Ending Community Homelessness Coalition in Travis County, to make sure that our perspective and the experiences that we're getting from people on the ground are being heard in this room, where all the big major providers, the VA and the city of Austin is there, the county of Travis County, there's representatives there, and Integral Care, and all these big players that are huge providers for those experiencing homelessness. But one of the things that we brought was the perspective of the lack of transportation, for example, and that a lot of the providers were kind of skipping over that particular portion. So when people have to go to work to try to get some money to get food or whatever else they need in their lives while they're still in an unhoused environment, it was hard for them to travel to get there, which started the bus pass, that pilot program a year or so back. And so being willing to, talk to your elected representatives, once you have that information, actually relaying that to people that can better do something about it, that have the funds to do something about it, even if your particular group can't, within your own capacity, making sure that's known about what the people are experiencing out there, because folks may not know in their organizations, as they're doing the best they can to serve, they may not know about these particular experiences that people are having that may be forming artificial roadblocks to their success in getting a housing community or whatever that might be.
Thank you.
Tiff,
And I see,
I also see a question from Claire. Do you mind if I jump in and answer that?
sure, go ahead.
Thank you. Claire, thanks for your
Thanks.
question about Indigenous populations. We do actually, that was part of the groups that, one of the groups that, I think actually two of the groups that we worked with in Los Angeles County, but we've also had a fruit and vegetable prescription program with the Navajo Nation in Arizona and New Mexico for the, believe we're in our 4th year of that program. And working with a number of different small healthcare systems throughout the Navajo Nation to help bring the program to people there. Lots of challenges in that world of the Navajo Nation. Humongous distances that people travel to do the simplest tasks. So we are currently working on bringing new technology to bear for that population to help make it easier, so that the residents of the reservation can be able to get the fruits and vegetables more easily.
And I know Claire also wanted to know, Phil, if you work with any Indigenous groups. Are there very many in Austin that are, because they have been hardest hit by COVID?
And none that are specific. I know there's a few Indigenous people that we do serve. There were a couple when I visited a more remote tent city further south. This was I-35 and like 271, I believe it was, that intersect up there. And so there's people that we serve, but as far as I know, there's not a particular group out there, since we focus on the downtown area and the folks that are living in those bridges, Cesar Chavez, a couple blocks over, and the various tent cities that have arisen, about a mile north of the airport freeway, stuff like that. We target those populations. So who is there is whom we serve. To put a finer point on it.
I know Claire has a follow-up question for David on infrastructure, but I did also want to give Jean a chance to speak. So.
I'll be quick. Thanks, everybody. I just wanted to. I'm the director of development for Wholesome Wave, and I want to thank the FFF team. Thank you for inviting us. And I want to say that, Phil, we're just so privileged to be on the same panel with you, because as David is explaining our work, direct service. That's a part of what we do as part of informing us, to do the research to then change policy. So part of some of the pivots that David's talked about, we've been able to be very clear and stay really true to our mission about bringing fruits and vegetables, affordability, accessibility, because that really is where, we feel from a nutrition standpoint, we can make a difference. Having said that, we've seen that we need to extend our programs at times. We've been in some towns and cities where, it's maybe a 6-month program, and we're kind of committed to a longer time frame to frankly get, more results. But to David's point earlier, the local partnerships they're everything, because we're not going to be there. We're not going to be there 12 months from now, necessarily. Wholesome Wave is not the brand, it's not the name that we're trying to leave behind. We are absolutely committed, and David and the programs team, really are so focused. And I will just tell you, the reason we got that LA work was because we stuck to our mission, and we have built a credibility around program management, and the CBOs know us. They like to work with us. They know that we treat them and their clients with respect. So I just, again, want to shout out to you and what you're doing, Phil, and everybody else. And just want to be able to give Foundation Beyond Belief, your creds, for including us in this group, because, and David did say, we're small. We do know what small is, we're not as small as others. So we are in that, small to medium size, and we're very fortunate. But we really do appreciate the support of just many foundations like this one. But thanks again for what you're doing, Phil.
Thanks, Jean, for just really, and Phil and David, for all the work that you are doing. FBB is really happy to support your organizations. I just wanted to know what else would you like for FBB or other organizations and volunteers to do in order to better contribute?
I think for Wholesome Wave, it's, you know, we're constantly raising money. We're a very cash heavy organization, obviously, because we're allowing people to purchase the fresh fruits and vegetables, but also spreading the word about nutrition security. It's a really big deal, and it's a really big need. And like I said before, it's been really highlighted during the COVID crisis. It's you know, a time period where you know, people have been now needing to learn more about nutrition and how it affects them. And I think that's one of the really important things that people can do. Volunteering with the organizations on the ground. Obviously, we're making a lot of partnerships with organizations just like Phil's, but volunteer, help out during this time period, donate money. Any of it matters. You know, one thing that we've seen, because we work in pockets across the US, is how much small organizations have taken on new roles, expanded roles, really changed the way that they work during this time period, because you see all of this pain and suffering going on, and you feel the need to do everything you can to help during this time period.
Yeah, I'll definitely second that one of the very last notions that you said about people seeing that pain and suffering. There have been more messages that have come in to our group, to the Facebook page or to the email, about people just asking, how can I help? Like, you know, what can I do? And, you know, and we go over kind of what their health risks are. You know, are you okay to come out, or is it better for you to donate from afar, that type of thing. And there's so many people that are wanting to help, even with the economic squeeze and all the changes that have happened in people's lives. It's still a prevailing thing, which I love. But as David said, you know, get out there and volunteer. Look and see who's around in your area. Go on Meetup or Google. You know, if there's someone in your area that is doing this kind of work, the work that you want to be a part of, or at the very least want to support, you know, please check that out and fund that, because those community organizations need that help, even if they don't explicitly, you know, put it out there. It's it's a lot of work to, you know, keep things going. And as we have gone over the years and having to spend more and more as time goes on to provide the same amount or more items to more people, now we're set at about 250 to 260 per giveaway. That's kind of where the good number is, where we don't run out. We have a few extra left over, and that's kind of where we want to be. It takes a lot of work. It takes volunteers. It takes money to do that. And so I think I put it in the chat here earlier. And so for my organization, for Austin Atheists Helping the Homeless, you can go to austinahh.org or just atheist.help. We'll get you to there. And there's the PayPal link and the Amazon wish list, which helps a lot, because those are direct items. So you can see exactly what it is you're buying, whether it be shave cream or granola bars or thermal socks or whatever it is. It's right there in your face, so you can see the impact that you're going to have on that side. And so please support your local organizations, because they really need your help to keep that going. I know we've needed a lot of help, and we've received so much help from organizations like FBB. We've you know, did a humanist watch party during the election and raised money that way. We raised several $1,000s to provide winter items to everyone that we serve in the Austin area. And there's no way we could have done that if not for that groundswell of support that happened during that long live stream. Thousands of dollars we raised to give every single person gloves, a thermal hat, thermal socks, and thermal underwear. Every single person out there got a pair of those items, every single one. And we made sure of that. And there's no way that groups like mine could do that without the generous support of folks out there that actually want to help and have the means to do so, even during this trying time. So thank you for that.
Yeah. And Jean makes a good point that there are people who did get stimulus checks that might not necessarily need that. So if you could spare that money, that would definitely just help, I think, with food insecurity as well. So thank you, Jean, for pointing that out. I did want to check in with everyone. So I know we asked you all on for an hour, but this is such an interesting topic, and it is a really important topic, so relevant right now. So anyone who needs to drop off, feel free to drop off. Otherwise, we're happy to continue the discussion with anyone who does have the time.
Tiff, if it's okay, I'd love to respond back to Claire. She asked a follow-up question. So Claire was asking about the infrastructure challenges for the indigenous people, specifically the Navajo Nation, as I was talking about. And absolutely, Claire, it's such a challenge to work in that kind of environment. So number one, we've tended to work with healthcare concerns that are on the reservation, and that's been a great way to get to the populations in need that we would like to work with. The other thing that we've done is we've spent a lot of time working with the grocery store opportunities. There are a few, I would say, multi-lane traditional grocery stores, but the majority are trading posts. The supply chain challenges that exist in the nation are humongous, but there's so much really creative people that do what they need to do to help people get the food they need. One really great example is one of the trading posts that we work with. I went to visit, and he had this whole case of beautiful fresh vegetables. I was like, how do you get those? Because a lot of the trading posts just have like pre-cut fruits and vegetables that they're able to get from distributors. And he said, come with me. And he took me out behind. He grows fruits and vegetables behind the trading post. He gives it to his family. He gives it to his employees. And then he sells very inexpensively as much as he can to help our program, but also to help the people that come to his store get the food they need. How amazing is that? I mean, he created his own supply chain because the supply chain issues are so tremendous out there. So that was just one really great example, but it requires a lot of creativity. What we're working on now is a way to make everything card-based across the trading posts and the grocery stores, because that would allow the participants, the patients, to not have to go to the clinic every time there was a new disbursement of incentives. So that way the card could be automatically reloaded. They could just go to the grocery store when they already are going to the grocery store and then be able to use those incentives. So that's the work that we're doing now to really upgrade that and make it easier. Again, talking about removing some of those barriers to make it easier for people. Healthcare and grocery stores are the two places that people will tend to go to on a regular basis on the reservation. So we make sure that we're using those as our primary points of working with the patients on the reservation. So thank you for your follow-up question, Claire.
I love to hear that there's a store that's growing their fruits and veggies and actually selling that out there. I know the food banks are starting to try to do that, but I mean, San Antonio has a huge, I've been out there picking sweet potatoes, which is interesting, and watermelons and everything else, just all this produce that gets out and then gets out into the community. But I think it's a wonderful idea. I've heard of community gardens and, the people do those type of things, but I really hope that keeps on, that food banks, get that space to actually do a little more on that gardening side, because it's an amazing thing. There's a lot of volunteers that would come out to help do that. It's fairly simple work. I mean, it's on your hands and knees a little bit, just depending on what's going on. But when you actually get to pick what you produce, like cauliflowers, we did broccoli, stuff like that, and we harvested the strawberries and another fruit I can't remember right now, but it's amazing to see the growth and what you can actually do, or it's just volunteers coming out there tending these fields. It's pretty amazing.
Yeah, it's true. And it's also a really sad truth on the reservation that individuals have over generations lost the knowledge about how to farm, how to grow their own food. And that's a big part of what the healthcare concerns are working with patients on, to be honest with you. off the top of my head, 3 of the clinics that we work with either have gardens that they work to feed patients when they come in, or even have clinics that they're clinic at a clinic, I know, that they're working to teach people how to grow when they're coming in. Again, being such a central point where people come to, they're really taking the opportunity to start to reignite some of these skills with the patients, which I think is really great. In fact, just to go back to it just one more second, one of the larger clinics we work with, which is more size of a hospital, small hospital, they've replaced all of their flower beds with vegetable garden beds because they didn't need to look pretty. The food issues are so great that they converted, the doctors and the nurses and the staff converted all of the flower beds to individual fruit and vegetable gardens. They tend it, they grow it, their families come and help. It's really quite amazing.
This has been a wonderful conversation so far, and it's been great learning more about, especially learning more about different groups and what you're doing. I had one last question, and I think this is something that everyone else wants to know as well. What is the best way to contact each of you and to really get involved in your work? Is it through the website, or is there direct contact link?
I guess I'll go to that first. But as I mentioned before, so you could look up Austin Atheists Helping the Homeless on Facebook or our website, and send us a message, PM us on Facebook, or there's a link at the bottom of every page on the website where you can contact us and put in your information to get in contact with us that way. I mean, I also have my email. It's Phil, PHIL, at austinahh.org if you want to send a message directly to me, and I'll get back with you that way. And so I usually get people asking about how they can start groups and that type of thing. And so I have a huge blurb that I send out now to say, this is how you get started. Like, this is where you begin. If you want to do this, it's not hard, but you have some friends that are with you. We can go through that type of thing. And so I'm always happy to lend a hand on that. I stay busy, but I always have time for that if people want to start something in their own neck of the woods, because your area best. Who's in that area. You would be the one to actually find out who needs that aid, where they are, and contact them to see what you can do to help them. And so you're one of the best resources that's available to them, because you can actually be on the ground to go speak with them and find out exactly what they need and get it immediately there. So don't shortchange yourself on that notion. It's a huge thing. But yeah, those are my places.
And Wholesome Wave is much the same, wholesomewave.org. And I see it chatted in, David at wholesomewave.org is the best way to reach me. But you can through our website as well. So thank you.
Thank you so much, David, Phil, and Jean. As they mentioned, their emails are in the chat and the websites are in the chat. I know there's so many questions that people probably want to ask, including how to continue to get involved in your organizations and their own communities. So just as a wrap up, I want to say that FBB is really excited to support all these organizations, including Atheists Helping the Homeless and Wholesome Wave. These are just a few of the organizations that we have supported, and we have an entire Beyond Belief network. Like I mentioned, at least 21 of those teams are involved in food insecurity. You can get involved in any one of those teams, and you can find out more about them, about Austin Atheists Helping the Homeless, other BBN teams, through our website. That's www.foundationbeyondbelief.org. And to support those teams, you can donate through our website, as well as text FBB to 44321. And then to donate to Austin Atheists Helping the Homeless or Wholesome Wave, you can go to their websites as well. I believe you both have donations set up there, and or volunteering applications as well. Thank you so much, everyone.
Thank you. Thanks for the opportunity, and thanks for your support. We've really appreciated it.
You know,
Thanks
this was
yeah.
awesome.
Yeah.
Thank you.
Great job.
Thanks for coming on.
Thanks, everyone.
Enjoy your weekend.
Bye-bye.
And bye. And a reminder to everyone else, we do have these monthly firesides. So the next one will be the last Friday of February at the same time, 7 p.m. Eastern. Thanks again.